This series of videos have been developed by Public Health Services. The sessions are designed to provide self-directed learning and cover the basics of infection prevention and control. This session is about single-use items, disinfection, and sterilisation. From this session, you will have an understanding of single-use items, single patient use items, and the appropriate method of reprocessing reusable equipment. Standard precautions refer to work practices that are applied to everyone regardless of their perceived or confirmed infectious status and are the minimum level of infection prevention and control. One element of standard precautions is cleaning and reprocessing shared patient equipment. In healthcare, equipment and instruments are used and either discarded or reprocessed. Some items are intended to be used once or for one patient and then discarded. Some items, such as manual handling equipment and patient observation machines, are costly and it is not possible to allocate an item for each patient, but they must be cleaned between patients. Other items approved for reprocessing are able to be disinfected or sterilised following use, such as endoscopic equipment or surgical instruments. It is very important to understand the cleaning requirements of equipment so that it is reprocessed to the level required. Some items are specifically intended for single-use or single-patient use. Items labelled single-use or that have the symbol 2 in a circle with a line through it, such as a needle and syringe, must be discarded immediately after use. Single patient use items may be used repeatedly on a single patient and then discarded, such as a blood pressure cuff labelled single patient use. Shared patient equipment can contribute to the transmission of pathogens between patients if it is not reprocessed correctly following use. All reusable equipment requires appropriate reprocessing according to its intended use and manufacturer's instructions. There are three categories of items in patient care: critical, semi-critical, and non-critical. Each category requires a different level of reprocessing. Critical items are objects that enter or penetrate into sterile tissue, a cavity, or the bloodstream, such as invasive surgical and dental equipment. These items must be cleaned thoroughly as soon as possible after use and sterilised after cleaning. Critical items must be stored to maintain sterility and be sterile at time of use. If sterility cannot be assured, the item must not be used and must be reprocessed prior to using. Semi-critical items come into contact with mucous membranes or non-intact skin and include respiratory and anaesthetic equipment and transesophageal echocardiogram probes. These items must be cleaned thoroughly as soon as possible after use and preferably steam sterilised. If this is not possible, high-level disinfection is the minimum level of reprocessing that is acceptable. Non-critical items come into contact with intact skin but not mucous membranes. Examples include items such as stethoscopes, blood pressure cuffs, commodes and IV pumps. These items require thorough cleaning between uses and storage in a clean, dry place. Cleaning and reprocessing shared equipment is an important element of standard precautions. Some items are single-use or single-patient use and must not be reprocessed. Other items are approved for reprocessing and are classified as critical, semi-critical, and non-critical. These items must be cleaned, disinfected, or sterilised according to the manufacturer's instructions and the item's intended use. This session has been based on the Australian Guidelines for the Prevention and Control of Infection in Healthcare. Thank you to the Australian Commission on Safety and Quality in Healthcare for permission to use this standardised infection prevention and control science.